Orthotics for pronation and overpronation, and why do we even need to treat this? So when we're looking at treating pronation and overpronation, usually what we're trying to do is prevent foot pain. So often someone comes to the clinic with complaining of a foot pain, and we look at their footwear, we look at their feet, and quite often what we find is that the foot will overpronate. Now, the reason overpronation causes foot pain is because it makes the foot a very inefficient lever for propulsion. So if we have a look at our foot here, when the foot's nice and straight, you can see that the arches of the foot make this really nice, quite long, high medial arch. So if we think of that like an igloo, like if you've seen one of the when they make a house out of ice, all the bones of all the ice bricks of the igloo stick together, and when they put weight on it, the weight's supported by the ice bricks. So what happens with the foot, when the foot's straight, all of the bones and joints lock in together, and they make it really nice, this nice sort of firm structure to propel off of. So it's like all the 26 bones of the foot act like one solid bone, and they can propel really quite well. But what happens when your foot overpronates, the joints of the midfoot unlock, and the foot becomes this loose bag of bones, is what we call it in the podiatry profession. And then as you try and propel off it, all the joints basically collapse under the weight of your body, and it makes it a very inefficient lever for propulsion. So what happens is when you try and propel off this pronated foot, all of the joints sort of grind and wear on each other, and the ligaments, or if you imagine they're little like rubber bands that hold all of the joints together, so there'll be one that runs between this joint and this joint and this joint. What they do is they get very stretched, and now they can take the strain for a day or a week, but when we walk on an overpronated foot for weeks, months and years, what it does, it adds micro trauma and micro injuries to these little ligaments, and eventually they start to ache and get inflamed, and because they can't adapt quickly enough to the loads that you're putting on your foot. So what we aim to do is, when we're treating overpronation with an orthotic, is we try and support the arch. So we'll take an off-the-shelf orthotic like this one here, and what we do is we place this under the foot to help to support the arch, and what that does, it helps to keep the foot close to its more neutral alignment, where all of the bones lock in, and like the arch in the igloo, and they lock in, and so it makes the foot a more efficient lever for propulsion. So all the force that goes down through your foot is able to be transferred forward, so you can propel off your foot. So that's the crux of what we do with an orthotic to try and treat an overpronated foot. We try and align the bones of the foot so they're more efficient, and the foot can work more efficiently with less active components trying to control the foot, like the muscles, and then you'll get less aches and pains, less foot fatigue, and less overuse injuries, and you'll be able to run for longer, you'll be able to stay on the sports field without injury for longer, and you'll have a more comfortable work day. So we try and support the arch with a nice soft supportive orthotic innersole. Now we can either do this with an off-the-shelf orthotic innersole for a mildly pronated foot, or if you have a more severe flat foot or a overpronated foot, or a condition that isn't quite normal, or your foot isn't quite the normal shape, what we will do is we'll make a custom-made orthotic innersole. Then these can be customized in every degree to absolutely match your foot condition. Now, it's also important to consider that if your foot has been pronating or overpronating for any length of time, it's likely that the muscles of your legs will also need to be relieved. So we stretch, we massage those, we can get on the roller, then try and loosen those off. And also, as always, using a great supportive shoe or a work boot will help to align your feet more, and they'll work with the orthotic to make sure your foot's in the most optimal alignment so you can walk more comfortably across the workday. I hope this helps. Thanks. If you enjoyed this video, please like and subscribe to our channel. It's very simple to do, and it really does help us out. If you need further information on the topics discussed, please follow the links in the description, and that will take you to our website where we've got more information on these topics. If you have a specific question that you'd like to ask, please comment in the comments section below, and we'll do our best to make a video to address your question. If you have any further comments or questions, you can find us at ergonx.com.au, and we look forward to seeing you in the next video.